you just walked in the room and you just spent 5 minutes talking to my kid about their best friend at school, who their teacher is, and what they like to play with, and how, what their favorite episode of Paw Patrol is. Why do you do that? Is that why you're always so late when you come to my work?
For one, part of it is building a relationship and building trust with the patients. A 2-year-old or a 3-year-old is going to be much more likely to let me look in their ears and their mouth and, do an exam if they've established that we're friends, we're friendly. But also it's a chance, especially in the younger ones, I can assess their speech and, how they're doing socially. So yeah, I guess that is one.
Yeah.
Get another kid.
Yeah, absolutely. As we get into the preteens and teenagers, obviously we're going to have different questions like that. But what's the point?
Well, I would hope, ideally, I would have been seeing this child throughout their life, so that I remember when they loved Paw Patrol, but now they like Taylor Swift. The whole idea is that we've known them for a long time and we're sort of tracking their interests and seeing how they're doing in this world. And so it's ongoing. And so when a child comes in at 15 and they're having some depression or anxiety, I've known them. And I remember what they were like when they were 2 and 3 and 4. And I can look back and say, who their friends were, what they liked to eat. And it helps to remember the child so that when they're older, and if there are issues, not always, then we know them and we're equipped to sort of deal with them. But if we don't have that relationship, how are we ever going to get them to talk to us about life? Particularly in the teenage years, when life gets a little bit harder.
Yeah.
So we're hoping that we have enough of a relationship that they would feel safe and know that we're a safe place to talk.